Good day, I am Arlene I. Salvador, third year student nurse from Nueva Ecija University of Science and Technology. And today, I will demonstrate a procedure on how to perform surgical hand washing. The goal of this procedure is to reduce microorganisms on hand, cross-contamination, and transmission of microbes and diseases. For the equipment, check for soap, running water, and paper towel. Since our procedure is surgical hand washing, therefore, the use of face mask and surgical cap is necessary. Implementation. First, nails should be kept short. Most agencies do not permit healthcare workers in direct contact with clients to have any form of artificial nails because it can cause injury to the client. Next, removal of all jewelries is recommended because microorganisms can hide underneath your jewelries. Since our procedure is surgical hand washing, therefore the removal of the jewelries is necessary. Next, check hands for breaks in the skin, such as hangnails or cuts, because breaks in the skin can be portal of entry. It allows the bacteria to penetrate the body defenses and cause infection. Next, if you are washing your hands where the client can observe you, introduce yourself and explain to the client what you are going to do and why it is necessary. Good day, ma'am. I am Arlene I. Salvador, third year student nurse from Nueva Ecija University of Science and Technology. Today I will going to perform surgical hand washing to reduce the microorganisms on my hands and to reduce the risk of infection. Since there is no patient around me or can observe me, therefore I can proceed now on doing surgical hand washing. Next, turn on the water and adjust the flow. There are 5 common types of faucet controls. First is the hand-operated handles. Next is the knee levers. Move this with the knee to regulate flow and temperature. Next is the foot pedals. Press this with the foot to regulate flow and temperature. Next is the elbow controls. Move this with the elbows instead of hands. And lastly, the infrared controls. Motion in the front of the sensor causes water to start and stop flowing automatically. Next, wet the hands thoroughly by holding them under the running water and apply soap to the hands. Next, apply soap and wash but hold the hands higher than the elbow during this hand wash. Next, wet the hands and forearms under the running water, letting it run from the fingertips to the elbows, so that the hands become cleaner than the elbows. If the soap is liquid, apply 4 to 5 ml or 1 teaspoon without touching the bottle. Use your elbow if necessary, or have someone to operate the soap bottle for you. In surgical hand washing, it is advised to use a brush with soap. Wet hands and use soap. Brush starting your palm, back of hands, and forearms in circular motion. Next, rinse the hand one at a time, starting from the fingers to elbow. After washing and rinsing, use a towel to dry one hand thoroughly in a rotating motion, from the fingers to the elbow. Use a new towel to dry the other hand and arm. If the towel is limited, you can use the other side of the towel to dry your hand and arm. Next, turn off the water. Use a new paper towel to grasp a hand-operated control, or have someone to do it for you. Next, raise both hands in front of you. Keep it above your elbow, ensuring that it touches nothing other than the procedure you're going to perform. Continue with the next procedure, if it is surgical gloving or gowning. There is no traditional evaluation of the effectiveness of the individual nurse's hand washing.